Hi everybody, it's Adam with HeartValveSurgery.com, and we're in San Antonio at the annual meeting of the Society of Thoracic Surgeons. I am thrilled to be joined by Dr. Patrick McCarthy, who is the Executive Director of the Bloom Cardiovascular Institute at Northwestern Medicine in Chicago, Illinois. Dr. McCarthy, it is great to see you again. We've known each other for a very long time.
We really have. So it's so good to see you again. I mean, we have to stop meeting like this, Adam. And what is it, 2 or 3 times a year that I run into you at the meeting? Always a pleasure.
Yeah, it's a gift to our community for the education. Dr. McCarthy, we're at STS getting lots of new research, presentations are going on, and we're getting lots of questions from patients about one of your specialties, which is atrial fibrillation. I understand you're here giving a presentation or a talk about potentially some new guidelines for therapy. Can you tell us about the changes to the guidelines?
Sure. So the guidelines were last updated in 2017, so this is new after 7 years. There's been a lot that has developed, a lot more information that is out there, and it's really important for the patients. So one of the most critical ones is that if you have atrial fibrillation, you should ask your surgeon if you're going to close the left atrial appendage. That's this little outpouching up on the top of the atrium. That's where blood clots form and cause strokes. The data is overwhelming that this is the thing to do. And as I said in my talk today, I did one on Tuesday, we timed it. It took 86 seconds to close that appendage, but we know from the data now it's going to lead to a 1/3 reduction in the risk of stroke. Like, that's about as good as it gets. Like, for something that is almost zero risk, really quick, and has such an impact on the long-term prognosis of patients. Really important breakthrough.
Yeah, and so for patients watching this who might have had AFib here and there, when they are getting ready for a valvular procedure or other open heart procedures, is this something that they should talk to their physicians about?
Absolutely. So any history of atrial fib, if they've only had one episode and it was 6 months ago, we know they're at risk for it. So if you have had atrial fib, don't hesitate, bring it up to your surgeon. Most of them will know what you're talking about and will know that they should close the appendage, and will hopefully tell you that. But the data now is rock solid that it is something that should be done.
Great. Well, Dr. McCarthy, on behalf of the patients at HeartValveSurgery.com, patients all over the world who are watching this, thanks to you and your team at Northwestern Medicine in Chicago, Illinois. Thanks for being with me today.
Always a pleasure.
Hi everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel. Watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.